I'm excited. What medications will we be going over today, Eliza?
So today we're going to be doing our Gonal-F pen.
Okay.
We're going to be doing our Menopur, which are the powders that we're going to mix, and then Cetrotide. So these are not all the potential medications you could use in a cycle, but these are 3 of the common ones. And we plan to be doing this about once a month, and then they're going to be recorded and posted on our website.
Yeah, they'll be under the resources section, which is a great place on our website where patients can go see all of the different medication videos, which you actually demonstrate.
My claim to fame.
Very well. So right today, if you're still wanting a little bit more information or wanting to see some of these steps again, you can see this video and others available on the website. So this set of medications, the Gonal, the Menopur, and the Cetrotide, is this a common set of meds that a patient going through either fertility preservation or IVF would use?
Yeah, so these are very common medications. All the injections that you would be taking during a fertility preservation cycle are hormone injections. So they're the same natural cycle-specific hormones you have in your body. We're just going to be giving you to that at increased concentrations. So there are variations in terms of different protocols. So sometimes you'll do some different medications that I'm showing you right here, which is why we'll do this every month with slightly different medications. But these are pretty common. The Gonal-F and the Cetrotide, there are other brand names that are the same medication that you're going to be taking, but based off of your insurance or pricing or things like that, people might choose to do the other medications. Just so you know, they're called Follistim or ganirelix. Exact same medications, but slightly different administration techniques. So that would be in a different video that we'll show. Menopur is almost always used when you're doing any type of fertility preservation or IVF cycle.
Okay. And do these medications, I guess we could go through them one by one, which we will, but do they go under different names sometimes? Like, or are they called different things?
So yeah, it just goes by like brand. So Gonal-F and Follistim are both FSH, that hormone. The Menopur really is the only one out there at this time.
Okay.
And then the Cetrotide, the other brand name is ganirelix. And those are both to ensure that you don't prematurely ovulate.
Okay. Okay. Great. I'm a little nervous, but
I'm going to talk you through each step.
Okay, perfect.
Let's see what time we could give like 2 more minutes.
Sure. Yeah.
If anyone has questions while you're in here and we're waiting, feel free to throw them in the chat.
And depending on the patient's protocol, like the dosing, I imagine, would be different for each patient.
Yeah, so typically a physician will determine your protocol and your dosing based off of a bunch of different diagnostic criteria, some being blood work, some being ultrasounds. Now that can change once you come in to start the injections, or it can change throughout the cycle based off of how you're stimulating.
Okay.
So typically you will get a starting dose, and that's how we'll determine how much medication to order for you. But as the cycle goes on, there's only so much information we have before you start, and we don't always know how you'll stimulate. So the dosing of the medication and how much you'll need can change as you progress throughout the cycle.
Okay. Good to keep in mind.
Yeah. And today when we do the demonstration, we'll be basing it off of just one of the more common dosing.
Okay, perfect. I think
Maybe we can start.
Yeah, let's get started.
Okay. So we'll start first by just going through how to prepare the medication, and then we will go through the injection technique.
Okay.
So the first medication we're going to be doing is the Gonal-F. Okay, so I'm going to be talking it through, and Agnes is going to show us how to do it.
This is my first time, everybody, so stay tuned.
So this is going to come in a big white box, and it's going to be stored in the refrigerator. Okay, you can take it out a little bit before you're going to inject, but you don't need to be too concerned about that. It's a pre-filled pen that all the medication is already pre-filled in there. Now, depending on your dose, this pen can come loaded with a different amount. So always be sure that you're checking how much this is loaded with and then what your dose is, because they come in 300, 450, and 900 unit pens.
Okay.
This is a 900 unit pen, and the dose we're going to be demonstrating today is 300 units.
Okay.
So it comes here with your cap on it. So you're just going to go ahead and you're going to take the cap off. You just pull it The cap other side.
Oh, this
Yeah.
cap.
Mhm.
Okay.
Okay. Now, because this is a multi-dose pen, just to be safe, you want to go ahead and just swab the top with alcohol every time. If you don't do this step, don't worry, you're not doing anything wrong. It's just to be extra cautious.
Okay.
Perfect. And then it's going to come with a bunch of these little pen caps. It's all going to come in the box with you. So what you're going to do is you're going to carefully take off that little piece of paper at the top and just make sure not to put your finger in there because it is a needle.
Got it. Don't want that. Yeah, I see the needle inside.
Perfect. And then you're going to go ahead and twist it right onto the pen.
Do you put the pen on top of the needle? Or?
Doesn't matter
Okay.
either way. And then you're just going to twist it all the way until you can't go anymore. You're going to almost hear it like click.
Yeah.
Perfect.
Okay.
Now you're going to see, and we're just going to kind of play with it a little bit so you can get used to it.
Okay.
There's 2 caps that you just put on. So if you go ahead and take the white cap off, you're going to see there's another white cap. Sometimes it's a blue cap right there. Now that's just for the needle itself. So when we do the actual injection, we're going to take this cap off. We're going to put it on the side. We're not going to throw it out because we're going to use that to help us take the needle off at the end.
Okay.
But this little cap on the needle here, you could just throw out when you're done.
Okay.
Okay. So you can put that back on.
Great.
So we're going to go ahead and flip over the pen so that we can see the dosing window.
This is the dosing window. There's a little, you can't see that great, but there's a little window here and it has a number in it. Right now that number is 0.
So it should always be 0 when you're first starting. If for some reason you used it yesterday and it doesn't say 0 now, just push out all the medication before you start and it will reset.
Okay.
But we're going to turn it up to 300 because that's the dose we're going to use today. So turn the other way.
This
Part you're going to turn.
the green one. Oh yeah, got it. Oh, and it clicks. Okay.
Yeah, you're going to hear it click. So you can go for a while. The good thing about this specific pen is that if you go past your dose, you can just roll right back. You don't need to reset it.
Okay. And it shows you the numbers, like as I'm going up, it's increasing. So we've hit 300.
Okay, perfect. So now you're pretty much all ready to go. This one is nice and simple.
Okay.
So would you like to practice doing the administration now?
Yeah, sure. Let's do it.
Okay. We have this handy dandy little thing.
So handy.
Very fancy.
And we can like put the medications on.
Yes,
Okay.
because this is capped. So this is why it's important to keep the cap on. So that's fine. If for some reason you forgot and took the cap off and you put it down, just carefully take that needle off and put another needle on. You never want to, reuse a needle again or use a needle that touched a surface that was open. They always give you plenty of extra needles, so you shouldn't need to worry about if you have to waste one.
Now this thing is supposed to represent.
This
like,
is going to
my
stimulate
stomach.
your stomach or your
Okay.
skin.
Okay.
So all of the injections we're going to be doing and all the injections you would do for the stimulation part of the cycle are going to be subcutaneous, which means they're going to go into the fatty tissue. Typically, we say the easiest place to do it is the abdomen. It's 1 to 2 inches to the side or below the belly button. And the technique is really just pinching an inch of that fatty tissue and going straight in 90 degrees, like a dart, like a pen.
Okay.
So the first step is always going to be that you're going to go ahead and wipe the area with an alcohol swab to ensure that it's clean before you do the injection.
This is different than the Lululemon pack I normally get around my
Yeah. We're gonna make this the new trend. Okay. Now, in terms of technique, again, it's just straight in 90 degrees. Now,
Okay.
and this is a tip, so again, if you don't do it, it's okay. The only tip I have is that the dosing window, you want to make sure that when you're injecting, it's facing up towards you, or if someone's injecting for you, that they can see it. And the reason being is that you'll notice when Agnes is going to push it in and inject the medication, it's going to go down to 0, the dosing window. Only when it goes down to 0 should you then take it out, because it means you have the full dose. If you take it out and it doesn't say 0, let's say it says 75, whatever it says is how much more of the medication you need.
Okay.
So let's say that does happen. You inject it, you take it out, and it says 75. So what you want to do is you want to carefully recap that needle, twist it off, throw it in your sharps, put a new needle on,
Okay.
and then dial it up to 75 and inject.
Okay.
So the concept is it should be down to 0
Right.
when you take it out.
Okay. Okay.
So you're going to go ahead and take the first cap off and you're going to put it on the side so we can use it after.
Okay.
Then you're going to take the second cap off and you can just throw it in the sharps.
Okay.
Now you're going to have the dosing window facing you.
Yep.
You're going to pinch an inch of fatty tissue.
Mhm.
Exactly. You're going to go straight in 90 degrees and you're going to push the plunger down till it's flush with the white almost.
Oh. This is hard. Oh, wow.
The
Okay.
skin is more, this skin is more difficult than your own skin. And you're gonna see it's gonna click down and
Yes.
it's gonna go down to 0.
Yes.
Once it hits 0, you can go ahead and take it out.
Okay.
Don't worry, that won't happen in real life. And then you're gonna carefully recap that. So be very careful not to stick your hands at the top, but on the sides of the cap.
Okay.
And then you're gonna put it on, and then it's like righty-tighty, lefty-loosey. So kind of try to take it off other direction.
Oh, I see. Okay.
Now, sometimes this is difficult. Sometimes it gets stuck. So if it does, you can always call us and we can help you. Perfect. So now it's off, and then this is going to go in our sharps container, which we have over here. Everyone should be getting a red biohazard bin or a sharps container. We're going to put all of your needles. No open needles or anything that has a needle on it should go in the regular garbage. It has to only go in the biohazard bin.
Okay.
If for some reason you get your medications and you don't have one,
Yeah.
you can use anything that can close. So an empty water bottle, Tupperware, anything like that.
Okay. Okay. Perfect. Good to know.
Okay.
Yeah.
Now, because we're using this again, it's a multi-dose pen. You're going to go ahead and put that original pen cap back on. And then that's going to go back into the fridge.
I see. So, right, because this contains like a 900 unit solution and we only used a third of that, 300, there's still essentially potentially 2 more.
Yeah.
Injections.
So 2 important things to note specifically about the Gonal-F pen, but in general. So it is important with a medication that you're using in a multi-dose pen or vial that you're keeping track, because you know you're going to be doing injections every day and you're coming in for monitoring and you're tired, and it's very easy to forget what you take, when you take. And unfortunately, it's not always super easy to calibrate on the side how much you have left. So I would recommend if you're keeping the outside box of the Gonal-F or on a piece of paper, just note like the date and how much you took, so that like if we put today and we could say 300, we know that there are 2 more doses.
Okay. That's
The other thing to note, and Folliston is the same, but the Gonal-F actually specifically says it. Doesn't have it on here, but it will say that it's in whatever the amount of units it is. So this is a 900 unit. And under it, it's going to actually tell you how much overfill there is in it, because there is overfill in there just in case you lose some medications here and there. So it will say, for example, a 900 unit pen has 1,050. So you actually really have 150 extra units in there.
Okay.
So it could be possible that if you, let's say, have 1 more dose that you need to take,
right,
and you don't want to get a full new pen, you may be able to take 1 or 2 or 3 pens together to create a full dose.
Okay.
So if you do 3 full doses, or you do the amount of doses that it is supposed to be on the pen, I wouldn't throw the pen out.
Yeah.
I would put it back in the fridge and save it till the end, because you could potentially use that.
Okay.
And the way you would do that, because again, it's hard to know exactly how much is in it, kind of going back to what we said before, is you would dial up to whatever your dose is. So you would dial up to, let's say 300, you would inject. Once it stops and you know it's not going anymore and you take it out, whatever dose is left on here is how much you need. So then you go to the next pen that you have the overfill on, you dial it up to whatever is left on here, and that's how you get collectively the dose that you need.
Okay. Got it.
So that is the Gonal-F.
Okay.
Does anyone have any questions about that?
If you have any questions, you can put them in the chat. And we'd be happy. I guess I have a question. Like, I know you said that this skin might be a little tougher, but I did have to use like some force to push the pen down. Is that common?
Yeah, I mean, I don't know if I would say force necessarily, but it is important that you will have to push the plunger all the way down until the red and the green are flush with the white. So sometimes when you're first doing it, it could be a little like stuck or tough.
Yeah.
So you do have to sometimes push it hard to get there, but you'll know, because you'll hear, like you said, you'll start to hear it click once the numbers are going down. So you got to push it all. Now, if you feel like, oh, you're pushing it and it's not coming out, you can tell, because if the number hasn't changed, then you know nothing has happened and it hasn't been injected.
Right.
And then you just make sure you're pushing all the way down.
Okay. Perfect. I think we have a question. Let's see.
Does any of what you are demonstrating also apply to progesterone shots? Unfortunately, no. Progesterone injections are the one injection type that are not subcutaneous. Those are intramuscular, so they go into the upper outer quadrant of the buttocks, because that has to hit the muscle. So technique wise of going straight in 90 degrees is going to be the same with all the injections you do. Those are going, unfortunately, is a bigger needle, and it's going into your muscle. So it's slightly different with these. You're pinching an inch of fatty tissue, and with the progesterone injections, you're actually going to be spreading the muscle to make it taut. But the straight in like a dart is still correct.
Are there any helpful resources for the progesterone shot specifically on our website?
Yes, so we have a specific video just for the progesterone injection, and just some tips in terms of things that could help. So the main thing is, you don't want to do the injection, and this is only for progesterone. You don't want to do the injection and then go to sleep right away. And the reason being is that the progesterone medication is compounded in oil. So if you do it and then lay down for a long time, it can kind of clump up into a ball and it'll just be uncomfortable. So I always say the more you can space it out before you go to bed, or if you want to take a walk after you do it, the more you can walk around, the better. We also recommend to even go in and actually do a massage in that area to kind of break up the medication.
That sounds like a great perk.
Yeah, exactly. So you can do it yourself. You can have someone come and do it for you. But not like a 2-minute massage, like a 20-minute massage. And like really to go in and like almost knead the medication and break it up. People use ice packs before. I wouldn't do that. And the reason being is that the medication can almost like freeze in a ball after. So instead of ice, you want to do heat. So after you do the injection, you can put a hot pack on the area or a warm washcloth, and you can even do the massage with that, again, to break the medication up. You can take Tylenol. That's completely safe to help with the soreness. But those are usually the main tips and tricks.
That sounds really helpful and just a great perk to
yeah, exactly. At least you get a massage.
Okay, I think if there's no other questions for Gonal at this time, we can move on.
Yeah.
Okay, let's go to the Menopur.
Okay, so this is the one that I know people get the most tripped up on, and I think it's really because it has a few more steps than the other medications. And this is, when you're really going to become a chemist.
Okay.
So this is when you're going in because you're going to be reconstituting the medication. So this is the Menopur medication. It's going to come in a box. A bigger box, and it's going to come in rows of 5. So it's going to be 5 powders. That's the orange peach caps, and you're going to see it's actually, let's see if I can get it close enough that you can see, it's an actual powder. And then you're going to have a row here of water vials, which is just your saline or your water. Now, some of the packs come where the water vials are a pink top, and then the medication is an orange top. So make sure you're looking at the actual medication. The Menopur will say Menopur, and the water will say like sodium chloride or bacteriostatic water.
Okay.
So the dose we're going to be using is going to be 2 powders or vials. Now this doesn't matter. The technique is exactly the same of how you mix, whether you do 1, 3, 5, it doesn't matter. You're just going to add on or subtract 1.
Okay, got it.
So the things that we need is going to be our Menopur powders and our water vials. In the box, there's also going to be a bunch of what are called Q-caps. These are just patient-friendly little contraptions that are going to help make it easier to mix the medication.
Perfect.
You're then going to get a syringe. Now, sometimes you're going to get a syringe that has this big needle on it. Sometimes you're going to get just a syringe. If it has the big needle on it, all you're going to do is just take the needle off. You're not using that.
Okay.
And then you're going to have a separate set of teeny little needles, and that's going to be the needle you're going to use to inject.
Okay.
And again, all the needle types that you're going to be using for the stimulation part will all be the same size.
Okay, good. Because this one's much larger.
Yes, correct. So that one is for the progesterone.
Okay.
Sorry.
Sorry.
Okay. So you're going to go ahead by, let's make sure you can see everything here. Okay. So you're going to go ahead and want you to take out your 2 vials of the Menopur and then the 1 water. So for every, no matter how many powders of the medication or vials of the medication you're going to use, you're always going to only be using 1 of the water vials. And the way to think about it or remember it is the water is not a medication. It's just there so that you can reconstitute it so that it's a liquid that you can inject.
Okay.
The other thing to note is in every water vial, there are 2 cc's or milliliters of it. We're only going to be using half. So 1 cc or milliliter. If
Okay.
you forget and you use the entire 2 cc's, it's okay. You'll just need to inject full 2
Oh.
cc's of everything.
Okay.
But again, that's not wrong. You're still getting the same amount of medication. It's just more saline.
Okay, got it.
Okay, so this part is just me. I like to be very clean.
We
So,
like that.
so I'm gonna get some extra alcohol salts ready. So the first thing you're gonna do is pop the caps off of all these. Now, try not to break your nails.
No.
You can do it with like the bottom of your thumb pad like that. Yeah,
Okay.
exactly. I'm just gonna get all those ready.
Okay.
Perfect. And then just for good measure, you're gonna go ahead and swab the tops with alcohol. You can just use one for all of them. Again, if you forget that stuff, it's okay.
Okay. Done.
Perfect. Now we're gonna go ahead and we're gonna take our Q cap. And you're going to just peel back where it says peel back, but again, be careful. There is a needle, so don't stick your finger in.
Right.
And then you're gonna go ahead and you're gonna stick that on the water vial.
Okay.
So it might be easier to just keep the water down here, and then you're gonna flip it over and stick it right on. You're gonna hear it's gonna like click on,
Yes.
and then you just pull the plastic part off.
Perfect.
Okay, so now that's on it, that's ready. This is what it looks like, okay? That's just gonna make it easier for us to mix.
Okay.
Now you're gonna take your syringe, so you're gonna open that up. And since we have a needle on ours, we're gonna take that off.
Okay.
So all you'll do is just twist it off. Perfect, and we're gonna throw that in the sharps.
Thank you.
Okay, now, again, this step is not necessary, but to help sometimes with the negative pressure of switching from one vial to the other,
Mhm.
we recommend to draw up some air into the syringe. Now, they say at least as much as you're gonna be drawing up of the liquid. So at least 1 cc or milliliter of air. It doesn't matter if you do a little more or a little less, that's okay.
So I brought it to the 1.
Perfect.
Okay.
Then you're gonna go ahead and you're gonna take that syringe and you're gonna twist it right onto the Q cap. So you're gonna twist it till you can't go anymore. Again, it'll kind of just stop going.
Yep.
Perfect. Now you're gonna go ahead and you're gonna push the plunger down to push all the air in. Now, this is the key tip. You're gonna hold that plunger down.
Okay.
And now you're gonna flip the vial over.
Like this.
Perfect.
Okay.
And then you're gonna draw back to the 1 cc or the 1 milliliter line. Now you're gonna notice on the plunger or on the, I don't even know what that's called, the little line where it tells you where you're at.
Yeah.
There are kind of 2 lines and then like the top part of the triangle. Some of them look a little different.
Yeah.
You're looking for the second straight line is what you're looking to line up.
Oh, okay. So the second straight line on the.
Like the top straight line. So every
Oh, yeah.
syringe, some syringes look a
Got
little
it.
different. A lot of them have like 2 lines on the stopper and then like kind of like a rounded dome or like a triangle. So you want to do that top line below the rounded part.
Like so.
Perfect.
So, right, you're talking about how like the black part of
Mhm.
the actual syringe, the top like line of that should be lined up with the 1.
Yeah, I mean,
Okay.
if you want to just show them like a close up in there.
Yeah.
So if you want to flip it around so you can see.
So if you can see, the top line of this black part is aligned with the number 1 to pull down 1 cc of liquid.
Exactly.
Okay.
Now I'm going to show you something. What happens if you don't do that little trick I told you? I'm gonna
Okay.
give that to you. So if we push the air in and I didn't hold the plunger and I flip it over, you're going to draw back a ton of air. So that's why you got to hold it. So
Okay.
if you push it down and you hold and you flip over, now you'll still draw back some air, but you're going to be drawing back mostly liquid.
Okay.
Now you're at the 1 milliliter or 1 cc mark.
Yeah.
Now we're going to have to switch over to inject it into our powder.
Okay.
So what you're going to do is you're going to, and this part is, I don't know, they couldn't make it better. You can kind of have to go side to side of just the water vial to take it off because you want to keep the Q cap on to go ahead for the powder. So you kind of have to like move it side to side, twist it a little bit. This may spray everywhere. Even if I did it, it would happen. Oh, good. Perfect. If it does, don't worry. It's just the liquid.
Okay.
Now you're going to go ahead and you're going to go into your first powder.
We flip this over.
You're going to flip it over right into the first powder. We're going to stick it on. And you're going
Yes.
to inject.
Okay. So we're dissolving the
Mhm.
powder with the water.
Correct. The second any liquid hits the powder, it will instantaneously dissolve and turn into liquid. So you can see now it's a complete liquid.
Yeah.
If for some reason you see a little like pieces of powder, you can just, turn it side to side, like kind of just move it side to side a little bit. But typically for the Menopur, it pretty much dissolves instantaneously.
Okay, you should be like gentle with this whole apparatus.
Yeah, just like side to side. Like you don't need to like shake it up in the air.
Yeah,
So
yeah,
fly
okay.
out. But yeah, just side to side.
Okay,
Okay, so now you're gonna again push down and hold the plunger and then flip it over.
Yeah.
And you're just gonna draw all the liquid back. So now you don't need to pay attention to the exact amount because you know how much you put in, just all the liquid. Now you're not gonna get every single drop. Again, even if I did it for you, I wouldn't. But you're gonna get as much as you can. Anything you're losing in the transfer is gonna be very marginal.
okay,
Okay, now you're gonna do the same thing. And it's okay now that she has air because we're not injecting anything yet.
and again, it's just the vial.
Just the vial you're taking off. We're only gonna take off the Q cap once we're completely done. Okay, perfect. And now since we're doing 2 powders, Agnes is gonna go into the second powder and do the exact same thing. So if your dose was only 1 powder, you would stop at that point, and then we'll skip to the next part. And if your dose was 3 powders or 4 powders, you'll continue doing this until you get to the amount that you are prescribed. And again, it doesn't matter how many powders, you're always concentrating it in the same amount of liquid.
Okay, I think we're good.
Yeah, looks good.
Pull down.
Pull all the way down.
And again, like, so when I was flipping the cap over onto this vial, some of the liquid like came out. But
Yeah, it's not gonna, unless you see that the entire syringe is empty, it's okay.
Okay,
Now that we're done, because we did our 2 vials,
Right.
we're gonna go ahead and you're gonna twist off the entire Q cap with the vial on it. So you can just twist it.
it's a lot of
So
ambidextrous.
yeah, so what you want to do is just, and it's another tip for you,
Yeah,
is just make sure that with this other hand, you're holding down the plunger because you don't want it to like squirt up when you take this off.
okay,
Exactly. So you just hold it in place
got it.
and then you're going to twist it all off.
Okay.
And then again, this whole thing is going to go into the sharps because it has a needle on it.
I do feel like having someone helping you during this process is like having a partner or like a friend who
Mhm.
can just like assist with taking stuff off and whatever is helpful.
Yeah, because it's not in the beginning, it is, you do have to get a little used to, especially with the Menopur, kind
Right.
of like all the moving parts.
Yeah,
So another recommendation I also have is you'll have access to all of these videos
Mhm.
at any point. So you can pull up, if you're like, oh, I'm doing Menopur, you can just pull it up. I would say pull it up a minute before you're going to do it and like step by step watch it as you're
Yeah.
doing it also. Because I know there are a lot of moving pieces specifically in this one.
right.
But you know, it's always nice to have someone help you, even just someone there as a cheerleader. you know?
Totally, yeah.
Okay, so now we're gonna get ready to inject. So what we need to do is we need to put on our injection needle. So again, it's that small little gray needle.
Okay.
So we're gonna open that up and then just twist it right on.
I might need assistance from my friend.
So what you're gonna do, you're gonna pull that right out.
Thank
Pull it
you.
out, and then you're gonna just twist it on again so that you can't go anymore.
Yeah. Okay.
Perfect. Okay, so now you're ready to
I'm
inject.
ready.
So again, you're going to be swabbing the area with alcohol.
And
This can put right down because again, the cap is on. So that's always the rule of thumb. If the cap is on, then it's okay to put down.
Okay, swabbing. And should you like if someone were doing multiple medications, should they be injecting like in the same spot on the same side? Should I?
So it's totally up to you. So depending on your protocol and what your doctor says, for a big chunk of the protocols, you're going to be doing injections twice a day. So morning and evening. So it's totally your preference. So some people like to say like, okay, Monday I'm going to do both on this side, Tuesday this side, or some people like to say the morning I'm going to do on this side, evening on this side, and then vice versa.
Okay.
Totally up to you. There's no difference in the outcomes when you do it that way. It's
Mhm.
just whatever is your personal preference. It could be sometimes you have a little bit more bruising on one side or one
Sure.
side feels a little sore and you can just alternate them.
Okay.
It is normal, by the way, to get some bruising from this. Again, even if I did it for you, you could get that because you can't see the capillaries under the skin. And there are a lot of times you're just going to hit them and then you'll have some bleeding and that's okay.
Okay. Okay. Nothing crazy.
Nothing shouldn't be anything crazy. No. So now we're gonna get ready and prime it. So we're
Okay.
going to go ahead and just take the cap off straight up. Perfect, put that on the side. And then you're going to, if you can see, I don't know if you can see here, let's see if you can come closer. There is like an air bubble at the top there. So we want to make sure that we get that out before we go ahead and inject. So you're gonna slowly push the plunger until you're gonna see 1 drop of medication at the tip of the needle. And it's okay if 2 come out, now we're good. If 2 or 3 come out, that's okay also, but that's how you know that the air is out.
Okay.
And now you're gonna get ready to inject. So same technique, pinch an inch of fatty tissue.
Mhm.
You're gonna go straight in 90 degrees, make sure the whole needle is in, and then you're going to push, and this is just, you're pushing the plunger until it's completely out. Here, the needle has to come out a little bit, this, technical difficulties, but it won't.
Okay, perfect. I think that was great.
Perfect. Now, this is going in the charts. Something to keep in mind, just so that you know there's something wrong. For whatever reason, the way the Menopur is manufactured, it burns when it goes in.
Oh.
It's hard for me to explain what the burning feels like, but that's how I would describe it, burning.
Okay.
So if that happens, there's nothing wrong. You're not having a reaction to it. That's just how the medication feels. And unfortunately, there's nothing to do about it. I'm not going to lie to you and say it gets better as you do it each day. It's probably going to feel like that the whole time, but it's normal. That's the most important part.
Okay. And it's like short lasting.
Short lasting. Yeah.
Okay.
I mean, it could be like a half hour, like you could have like
Yeah.
lasting effects, but like by the time you wake up the next morning, you shouldn't feel it.
Okay.
It's not anything like that.
Perfect.
Okay. Does anyone have any questions about the Menopur?
Eliza, can I be having some alcoholic beverages while I'm doing my medication trial?
It's definitely a common question that people like to have. So you can,
Okay.
you want to keep it more to a minimum. So, a couple times a week is okay, not every day. You want to keep it to 1 cup and always followed by a full glass of water. So these medications will bloat and dehydrate you, but you might not necessarily feel thirsty in the way you would normally.
Yeah.
So you want to stay on top of it and stay very well hydrated, not only with water, but electrolytes, Pedialyte, Gatorade, vitamin water, coconut water, anything like that.
Okay. Perfect. Thank you.
Of course.
On top of mind.
Okay, so if we don't have any questions, we can move on to the next.
Perfect.
So the next medication we're going to do is called Cetrotide. This is also going to come in like a skinny white box, and these will also be refrigerated.
Okay.
Things to keep in mind for the refrigerated medications. So for the Cetrotide and the Gonal-F, if for some reason you have left it out and forgotten room temperature, they are both good for 28 days once they hit room temperature.
Okay.
If they're like left outside in the summer and they're hot, then no. But for room temperature, 28 days. Okay. With the Gonal-F, once a pen is open, it's good for 28 days, even if it's refrigerated. So those are just 2 things to keep in mind.
That's helpful. Yeah, don't leave these in the sun.
Don't leave these in the sun. No. Make sure if you're delivering and it's coming, you're there to get them.
Yeah.
Okay, so the nice thing about the Cetrotide is that everything you're going to need, it's like a one-stop shop, is here in this little pack.
Okay.
So if someone says you're taking 1 Cetrotide, it's all a standard dose, and it's just one of these boxes.
Perfect.
So when you open this up, you're going to have a few items. You're going to have your actual medication, which is again a powder vial.
Mhm.
You're then going to have a syringe that's already pre-filled with your sterile water. And then you're going to have 2 needles. You're going to have this big yellow one. Again, if it looks too big for these injections, it is too big. And then you're going to have your small gray one that you'll use to inject.
Okay.
So we're going to do same thing like we always do. You're going to go ahead and take out the powder of the Cetrotide, and you're just going to swap the top. Again, if you don't do that, it's not wrong.
And right, this one doesn't have like a cap.
Yeah, there's no cap on this one.
Okay. Done.
Perfect. Now you're going to go ahead and take your big yellow needle. You're going to twist off the bottom part that you just kind of just separate it. Perfect. Yeah. So you can put that down. And then you're going to take your syringe and you're going to just twist on the needle.
Now this syringe has
the liquid
It's
in it.
pre-filled,
Yeah.
okay.
So there's no like measuring or anything like that. You're just reconstituting.
okay.
Now you're going to take the top off. Now, unfortunately, the Q caps don't fit on this, which is why we have to do it this way. It's going to go straight up. Yep. Now what you're going to do is you're going to flip it over and you're going to stick it right into the middle of the vial. Yeah. Then you're going to push all the water in. Now for the Cetrotide, unfortunately, it doesn't typically dissolve as easily as the Menopur. So you will have to kind of swish it or like kind of do side to side. Yeah.
Yeah, there is a lot of powder.
Yeah, this one also is a bit expired, so the powder might be a little harder to dilute, but you can kind of just like go around in a circle, twist it around
Oh, there we
side
go.
to side. Again, nothing crazy. You don't want to like, throw it all around, but not to be, and it's okay if there's like a flake here and there, but you want it to be mostly mixed. Now, this is the part that can be a little tricky. So just the tip is you're going to flip it over.
Okay.
And then you want to make sure that the tip of the needle is below the liquid. Okay. Otherwise you're going to drop air. So you're going to pull it down, and then it's going to be hard even if I bring the vial closer for you to see, but inside of the vial at the top, there's a little gray stopper. In that gray stopper, there's a little kind of line or hole in the middle. You can see it here.
Oh yeah. Okay.
Okay, there's like a little hole in the middle that's see-through the whole thing. So you're going to start by making sure that the needle's below the vial, below the liquid, and you're going to start pulling back on the plunger to get the liquid. Now, as the liquid comes down in the vial, you're going to have to move the needle lower down to be under it. And then what you want to do is you want to keep it, you'll make sure you have that little opening facing you, because then you'll see you can bring the needle all the way down until you get everything out.
Oh, I do see.
See, and then it's coming all the way down. Perfect. Great. So now you have it all out. So you're going to take that off. Perfect. You're going to carefully recap that big needle. So try not to stick yourself. Yeah.
Should it click?
It might not click, but it just feels like a
I
little
think
tighter.
it's in there.
And then you're going to twist it off.
the whole needle.
The whole needle, because we're not going to use that one. That's just to mix. Other direction. Again, this is training, so
Yeah.
don't do this at home. Okay. Yes, you should be able to just twist it off. Like
Okay,
that, and that's
perfect.
going in the sharps. And now you're going to take your small injecting needle. Oh, okay. Again.
Pull
Let's
it.
pull it off. And now you're going to twist it on.
Okay.
So it can't go anymore.
Got it.
Okay. Now you're ready. So you want to put that down, and you're going to take it out the wall.
So that one's really the only one that really kind of requires, like you said, a little more chemistry is the Menopur one.
Correct.
Yeah.
Exactly. And that one you'll be doing, typically you'll start it at the beginning of the cycle and do it the whole cycle. So you will get used to it.
Okay.
So it's going to be same thing. We're going to take the cap off, and we're going to push the plunger slowly till we get that one drop of medication at the top. This one sometimes, takes a little longer to get to the top. That's fine. And again, it's going to be straight in 90 degrees in that fatty tissue. And you're going to just push until all the medication is in.
Great.
Perfect. And then this whole thing will go in your sharps. Now, only thing to note about the Cetrotide is, for whatever reason, a lot of people tend to get a site reaction,
Okay.
usually within the 30 minutes to an hour after you do it, meaning you'll have some redness or some itchiness right around where you did it. Again, you're not having an allergic reaction. It's fine. It will go away by the time you wake up. If for some reason it does spread, then definitely let us know. But that is just very common. It's like kind of an irritation to the area.
And you said it's just like limited to the site.
It should be limited just to kind of around the area where you did the injection.
Okay.
Yeah,
Perfect.
just kind of like an irritation.
Good to know.
Does anyone have any questions?
About any of the meds?
Any of the meds, about cycle, the common questions you have?
And again, like if you're cycling, your nurse will be like updating you with how you're progressing throughout your cycle and like what medications and doses you'll need to take.
Yeah, so the way it's going to work is once the doctor determines, or you guys determine together, you're going to be doing some type of IVF or fertility preservation cycle. You'll be set up, they're going to send you a bunch of online modules that's going to go through what we do here, the whole process, what side effects, risk factors, etc. And then you're going to be sent the specific videos of the medications that you are going to be prescribed. All of those we recommend and require you to watch before you start. So if you watch those medications, you're going to be coming in always the day before the day that you start. So you're going to come in for monitoring. We're going to do blood work and a transvaginal ultrasound to make sure everything looks good for you to start. If you have any questions about those medications or you want to review anything in person, you can always ask to speak to a nurse at that time.
Mm-hmm.
A nurse will also be calling you after every visit that you come in. So every time you come in for blood work and an ultrasound, you're going to get a phone call with those results and then your next step. So if you have any questions at that point, you can always speak to the nurse as well. If something happens after office hours and it's urgent, you medication falls on the floor and it cracks open, we always have our after hours doctor's service, and that's just calling our main line and it will take you to them, again, only for emergencies.
Yeah,
But sometimes things happen and things come up. And again, each time you come in, you're going to be getting instructions until the next time you come in, because it is so time sensitive and it is so sensitive to your body itself of how you're responding. We're only going to give you instructions from one time to the next because things can change as it goes along.
Sure, yeah.
Yeah. I'll tell you common questions that I get asked a lot.
Yeah.
You know, we try to make this process as, I would call it, like life friendly as possible. We don't want people to have to stop their whole lives
Right.
to come and do this. So, you know, a lot of things that people ask besides, let's say, the alcohol is, can I exercise during this?
Oh, yeah, that's a big one.
I know it's a big one.
Yeah.
So, you can, but with a caveat, there are restrictions. So, again, the purpose of the medications is to take whatever baseline follicles, which are the fluid-filled sac that holds the egg. We want to get as many of those to grow and develop from these medications so that we could get as many eggs or retrieve as many eggs as possible.
Mhm.
So when that happens, your ovaries are used to, in a regular menstrual cycle, 1, maybe 2 follicles developing.
Sure.
Now we're potentially having multiple follicles developing. So your ovaries are actually going to be heavy. Okay.
Okay.
So we want to prevent something called ovarian torsion, which is an extremely rare thing, but could be a complication where the ovaries twist over themselves, and that's a medical emergency. So obviously we want to make sure we don't do that. So with that in mind, we don't want to do any exercises during the cycle that are specifically jostling to the core. So anything where you're going kind of up and down in that motion or twisting side to side are things you want to stay away from. So no running, jumping, spinning, yoga with inverted positions, things like that.
On my face.
Yeah. You can walk outside, walk on a treadmill, stationary bike, that's all fine.
Okay.
But nothing where it's a lot of that up and down motion.
Mhm.
Those exercise restrictions stay in play throughout the cycle. And then typically we say that you should keep them until about 2 weeks after the cycle, or when you get your period, which is usually within a week to 2 weeks after the retrieval.
Suggesting that like everything's kind of settled back.
Exactly.
Yeah.
So it takes approximately 2 weeks for the ovaries to come back down to their original size.
Okay.
And the thought is typically when you get a period, that means all the hormones have come back down to baseline.
Okay. Got it.
Another thing that people like to know about, understandably, is what are common side effects.
Yes.
So because these are the same hormones you have in your body at increased concentration, I like to think of it as whatever your PMS symptoms are times 10, potentially.
Oh.
So mood, irritability, most common are probably going to be like bloating, headache, and fatigue. Those are the most common you're going to see. Of course, there are people that can have, you know, the one-off reactions, or people feel differently, and some people feel completely fine. So it doesn't mean that you're automatically going to feel this way. You can feel a little bloated, things like that.
Sure.
Typically, if you're having symptomology, it will start to increase as you get closer to retrieval. But again, everyone's different.
Mhm.
The important thing is to keep on that electrolytes that will help you with the bloating. And then for headaches, you can take Tylenol throughout the cycle.
Okay.
As the cycle starts to progress a bit and you get closer to the procedure, you do want to stay away from any NSAIDs, so anything that could increase bleeding. So Advil, aspirin, ibuprofen, anything like that.
Okay. That's good to know. Tylenol all the way.
Tylenol all the way.
Yeah.
Okay.
Not an ad, but
Does anyone have any questions about the medications, about the cycle in general?
and again, this video, we're going to put it up on our resources page of our website, and that's where all the videos live. Again, like Eliza said before, those videos are great, as this one will be too, because you can like play and pause them. So if you are going through the process in real time, you can pause the video, watch it, do it yourself, pause it, rewind. So I would definitely make use of those videos. They're a great resource.
Yeah, and we plan to do this about once a month. So
Yes.
next month we'll do the Menopur, will do the same, but we'll do the other medications. So if these are not the medications that you are prescribed, tune in next month. Hopefully those will be the ones. And if anyone has any requests ever, you can always DM us on Instagram.
Definitely.
Yeah.
Yeah.
Or any requests in general for any type of webinars. We're
Yes.
always
Happy
Open to
to
them.
accommodate, yeah. And yeah, you can sign up for the these upcoming webinars and other events on our website, rmany.com, under the events page. They're all there. And yeah, thank you so much for joining us. We really
Thank
appreciate it.
you.
Thanks, everybody.